Hi, Alvin here, natural health practitioner, chiropractor, and speaker. And thanks for tuning in to this 3-minute health tip. Now, in this episode, we're going to expand a little bit about what we've talked about in the previous videos about this new health perspective known as GNM and the 5 biological laws. In this episode, we're going to go into the second biological law, which states that every disease or biological program actually occurs in 2 phases, provided there's a resolution to the conflict. There's the conflict active phase, or the stress state, and then the second phase is known as the healing phase. And so I'm going to really illustrate the 2 phases with an example. Now, if you go to work on Monday and you sit down in front of your office, you check your emails, and the first thing that you get is an email from your boss stating that on Friday, 5 people are going to be laid off in your office. Now, if that email comes as a shock for you, if that's a conflict shock, you instantly are now running a biological program. And as we mentioned, there's 2 phases to this biological program. The first phase is the conflict active phase. That's known as the stress state. The moment that you read that email, perhaps you call your spouse to tell them, oh my gosh, I may lose my job on Friday. You're now in a stress state. What does that mean? That means that at an emotional level, you're preoccupied with what are you going to do if you lose your job? So you can't get it out of your mind. There's already going to be an impact somewhere on the brain that's measurable in a CT scan. And where that impact goes, as we learned before, is based on how you subconsciously and subjectively perceive that email. And then there's going to be changes happening somewhere in the organ that's controlled from that area of the brain. But those changes, 60 to 70% of the time, you're not going to feel. In fact, during the conflict active phase, the only symptoms we tend to experience are cold hands and cold feet because we're stressed. Also, because we're stressed, we're waking up at 1 or 2 in the morning and we can't fall back asleep. So we get interrupted sleep, and you don't have much of an appetite during the stress state. But despite all of those changes, you're actually having a lot of energy. And so we often don't notice that we're in a stress state unless you're aware of it. You're going to be in that stress state for about 4 days and 4 nights until Friday comes along. When you go to work on Friday, if your job is safe, you relax emotionally. Now you enter the second phase, which is the healing phase. And it is in the healing phase that emotionally we relax, the changes in the brain and the changes in the organs stop, and that organ that was affected is restored and repaired back to its normal state. But just like any healing phase, there's often inflammation and swelling that goes to that area to protect it. And that's often when we experience symptoms. Pain, discomfort, headaches, dizziness often occur in the healing phase. This is also where we get fevers, diagnoses of infections, back pain, all occur in the healing phase. The length of time that we're in the healing phase and the intensity of the symptoms are often proportionate to the length of the conflict active phase or the stress state and the intensity of the shock. This is important to note as you're looking back into your own life in trying to really identify what you've dealt with, what conflicts you've experienced, and why you've had certain symptoms for as long as you have. I hope that this video is valuable in helping you to really identify what phase you're in right now based on the symptoms that you may be experiencing, and that your awareness of connecting it to the conflict and resolving it can help shorten that healing phase and minimize the intensity of the symptoms. So I want to thank you again for your attention. I hope that this tip was valuable. I look forward to seeing you in our next episode.